Common medications. So obviously it's unreasonable to think that we're going to cover every single medication in existence. So we'll just cover some of the main groups of medications. Just like with anything else, you're going to become more familiar with the medications that are frequently used in whatever care area you end up working in. Again, we're going to go over the common medications, aka those that are used the most often. So don't get too concerned, that we're not learning all of them. Most medications have 2, 3, 4 different names. And even after over a decade in the medical field, some of them still catch me up. So like I said, we're just going to go over those common groups of medications. So here are some common analgesics, which mean that they help the pain go away. So a lot of these are over the counter, things like Tylenol, which works, or acetaminophen works as an analgesic and an antipyretic. Antipyretic means it helps reduce fever. NSAIDs, non-steroidal anti-inflammatory drugs, act to reduce pain and inflammation. And these include things like ibuprofen, which is also known as Motrin, ASA, aspirin, naproxen, which is Aleve and naproxen, and Toradol or ketorolac. Narcotics in the order of increasing strength, tramadol and codeine, hydrocodone, acetaminophen, often called Vicodin or Norco, oxycodone, acetaminophen, called Percocet, OxyContin, which is more often a slower release, roxicodone or oxycodone, Dilaudid or hydromorphone, potent and longer acting than fentanyl, and then fentanyl or Sublimase is short acting but very, very, very potent. So some of you might be familiar with some of these drugs. Fentanyl is unfortunately very easy to manufacture, and this has been playing a huge part in our continuing opioid epidemic, and it's contributing to a lot of overdose deaths because it is so very potent that it only takes a small amount to shut down your respiratory centers. These are just some of your common antibiotics. As you can see, there's several, and this is not even close to covering all of them. Just know that antibiotics affect different organisms depending on the nature of the organism, whether it's aerobic, anaerobic, gram-positive versus gram-negative. And most antibiotics can be given systemically, so usually orally or via IV, or locally, so usually some kind of topical ointment or topical lotion, so that we're not sending those antibiotics throughout the whole body. So this chart is just kind of building on that concept that I just said, that antibiotics are targeted towards certain organisms. You can see that certain antibiotics cover more than one group, so they're considered broad spectrum. But this is just for your FYI, not necessarily something that you need to have memorized. I certainly don't. Common antiemetics. So emesis is vomit. So these are medications to counteract nausea and vomiting. The following medications all have the same effects in that they do help prevent or cease the urge to vomit. However, they act in the body in different ways. So there's meclizine or Antiavert. So this is an anti-vertigo medication. Ondansetron, Zofran. So this is available orally, as a tablet, sublingually, so underneath your tongue, and in an IV form. I think this one is probably the most common. If you've ever gone to the doctor for nausea, this is most likely what they gave you. Promethazine or Phenergan, which is an antihistamine that can be used as an antiemetic, and then Compazine. This is actually an antipsychotic med that is first-line nausea vomiting therapy. That isn't first-line nausea vomiting therapy, but can be used in severe nausea vomiting. So antithrombotics. So there's anticoagulants and platelet inhibitors that fall under this umbrella. So anticoagulants prevent clotting of the blood, aka blood thinners, oftentimes used prophylactically in people or with conditions predisposed to clotting, things like atrial fibrillation, a history of stroke, congestive heart failure. Warfarin or Coumadin may be counteracted with fresh frozen plasma and vitamin K. Enoxaparin sodium, or Lovenox, is a low molecular weight heparin that is administered subcutaneously, so usually in a pinch of belly fat towards the bottom of the abdomen. And then heparin can be given sub-Q or IV via titrated drip. Platelet inhibitors, these prevent the aggregation of platelets that occurs in response to injury or impair the final act of platelet aggregation. So it makes the blood less sticky. Rather than thinning it, it makes it less sticky. So we have aspirin or baby aspirin, which is usually prescribed daily in those with heart disease. A full dose of aspirin is 324 milligrams and is used in more acute scenarios, like if somebody's acutely having a heart attack. Clopidogrel or Plavix, Prasugrel, Effient, Tigrelor, Brilinta. You can see, again, a lot of these medications have multiple names that are very hard to pronounce. So really what I want you to remember from this slide is just the difference between these two kinds of antithrombotics. So anticoagulants interfere with clotting factors, so they stop thrombin from binding to antithrombin and or impede the action of vitamin K. And then antiplatelets interfere directly with platelets, binds to platelets to make them slick so they can't stick together. So thin is anticoagulants, slick is platelet inhibitors. Antihistamine. So H1 blockers block histamine 1 receptor and thus inhibit the activity of histamine. Things like Zantac, Pepcid, it's commonly used to treat heartburn, but are often used in conjunction with an H2 blocker to decrease inflammation secondary to a histamine release. So a lot of people, I don't know if you've ever heard of Asian flush. So it's an allergic reaction that often occurs in those of Asian descent when they drink alcohol. This is an example of how this histamine blocker can be worked. Many people will take Zantac or Pepcid and they don't have this allergic reaction. H2 blockers block the histamine 2 receptor and inhibit the activity of histamine via a separate route than H1 receptor. So things like Benadryl, Claritin, Zyrtec. Benadryl is shorter acting, and then Claritin and Zyrtec are longer acting. Beta blockers. So these block the activity of epinephrine, which is a vasoconstrictor, meaning it makes the vessels smaller, by binding to beta adrenergic receptors that bind to epinephrine. So the common therapeutic uses include hypertension, congestive heart failure, and arrhythmias, so other than normal heart rhythm. Common drugs are atenolol, carvedilol, metoprolol. So you can see that LOL at the end is going to generally indicate a beta blocker. There are beta 1 and beta 2, selective and non-selective. So in hypertension, beta blockers promote vasodilation and therefore decrease blood pressure. So if the vessel is bigger, the blood is not having to move through a smaller area, it decreases blood pressure. In CHF, it slows electrical conduction of the sinus node, which is your pacemaker, and the AV node, allowing for greater filling time during diastole, which is when the heart is at rest, and an increased ejection fraction. So it allows for more oxygenated blood to be leaving the left ventricle. And then arrhythmias. It slows the electrical conduction again in the sinus node and the AV node. That reduction in heart rate allows the heart to restore a more regular rhythm and various tachyarrhythmias. So in various high heart rates. Calcium channel blockers. So these block the activity of voltage-dependent calcium channels, which are present in the cardiac muscle cells as well as the smooth muscle of blood vessels. By reducing activity of the calcium channels, heart rate is reduced by reducing voltage conduction from the SA and AV nodes to the ventricles. So it's used to treat arrhythmias. Via the same mechanism, calcium channel blockers cause arterial vasodilation and may be used to counteract high blood pressure and angina pectoris, which is chest pain. Examples of drugs would be amlodipine, Norvasc, which is a long-acting calcium channel blocker, or diltiazem or cardizem. Then we have ACE inhibitors, angiotensin converting enzyme inhibitors. These block the conversion of angiotensin 1 to angiotensin 2, which is responsible for multiple processes that cause water retention, therefore increasing blood pressure. So they decrease blood pressure by promoting fluid loss and vasodilation, so used to treat things like hypertension and congestive heart failure. These are your prils, P-R-I-L. So examples would be enalapril and lisinopril. Diuretics. So these work to induce diuresis or urine production to reduce volume of bodily fluids in those with hypertension, congestive heart failure, chronic kidney disease, and or other renal or cardiovascular conditions. An example would be hydrochlorothiazide or Lasix. There are many others. Your primary concern is knowing medication spellings. That will be more so especially in your designated care areas. Antacids. So these mitigate symptoms of indigestion, heartburn, and acid reflux or GERD, gastroesophageal reflux disease. There are over-the-counter antacids and prescription medications. Tums, which I'm sure many of you have taken before, made of calcium carbonate, is a base that creates a bicarbonate buffer in the presence of acid. So your stomach produces a lot of acid in order to break down food products. So this is kind of counteracts that if there's an overproduction. Omeprazole or Prilosec is a proton pump inhibitor and reduces the secretion of acid from the parietal cells of the stomach. And these are taken on a regular basis rather than for symptomatic treatment. So usually this would be a daily medication. And pantoprazole, see, they're hard to pronounce, or Protonix, also a PPI that is often given in the hospital for patients that are bedbound or expected to be in bed for a while to help prevent reflux. Then we have laxatives, stool softeners, and suppositories. So they're osmotic laxatives, which stimulate the release of water and electrolytes into the intestinal tract, things like milk of magnesia and magnesium citrate. Stimulant laxatives, which increase contractility of the intestine, things like Dulcolax or Bisacodyl, Zenocot, and then stool softeners. These cause retention of fluid within the GI tract. Things like prune juice, Miralax, and Colace. Suppositories, so technically this applies to any medication that is administered rectally. So this is not only laxatives, this can also be rectal Tylenol, but however, they're commonly medications or solutions administered to promote the passage of stool. So mineral oil, saline, glycerol, and barium. Glucocorticoids, aka steroids. So these are anti-inflammatory molecules or medications used to treat a wide variety of conditions. So these can increase blood glucose levels. So oftentimes physicians and providers will take this into account, especially in your diabetic or insulin-resistant patients. So in order of increasing strength, we have cortisol. So this is the human body's natural glucocorticoid. So this is something that you yourself will produce generally in times of stress. So to include illness. Prednisone, so converted to prednisolone in the liver. Prednisolone, an active metabolite of prednisone. Methylprednisolone or Solumedrol, and dexamethasone, a potent anti-inflammatory. So you'll see these medications often used for patients that are suffering from severe respiratory illness to help decrease inflammation in the lungs and the pathways to the lungs. Glucose regulation. So I think the thing that probably comes to most people's minds would be insulin, but there are some commonly used, or the most commonly used oral medication would be metformin. So it just decreases glucose production by the liver. Basal insulin products, things that are slow acting, that provide a baseline level of insulin throughout the day, things like Lantus, and then prandial insulin products, so fast acting and taken at mealtime to counteract short-term blood sugar spikes related to that consumption of food, so things like Novolog and Humalog. Again, this is super, super basic information. There's a lot more different types of insulin, what they do, when they're to be taken, but for your purposes, it's not necessary. This is just a brief introduction to the medications. Nitrates, so these produce nitric oxide, which is an endogenous vasodilator. So vasodilator, again, making the vessels larger. And used in the treatment of hypertension, angina, so chest pain, and acute myocardial infarction, which is a heart attack. Imdur mononitrate, or just Imdur, is indicated for the prophylaxis of chest pain. Nitroglycerin, its primary use is as a short-acting vasodilator, and consistent use may induce tolerance. So this is one of the drugs often given during acute myocardial infarction, so acute heart attack. SSRI, selective serotonin reuptake inhibitors. So these increase circulating serotonin between neurons in the brain. It's most commonly used in depression and anxiety disorders. So citalopram, Celexa, escitalopram, Lexapro, fluoxetine, Prozac, sertraline, Zoloft, and venlafaxine is Effexor. Statins. So statins limit the endogenous production of cholesterol by inhibiting the key enzyme and act to reduce cholesterol in those with hypercholesteremia. So things like atorvastatin, which is Lipitor, Rosuvastatin, Crestor, and Simvastatin, Zocor. So the statin drugs pretty much all do the same thing. Topical creams, so there are several, obviously. Topical just meaning you put them on the skin or on the surface of the body. They do not go into the mouth. They do not go in through the veins. They can be used for various types of rashes, infections. Common medications and uses are as follows. So hydrocortisone, which is a steroid medication. Cortisone is similar to cortisol, the body's natural steroid. It is typically used for rashes that are non-infectious in origin. So things that are more related to a allergic reaction, like a reactive dermatitis or eczema. Barrier creams, things like Desitin or Vaseline, are commonly used to prevent physical irritation of the skin. So Desitin is often used as a diaper rash cream. Antifungals like Lotrimin treat fungal infections of the skin. So if anybody's ever had like athlete's foot, this is what goes in and kills those little fungi. Vaccines and immunization. So as y'all know, there's many vaccines. And really your job as the medical scribe is just to make sure that the patient's vaccine record is up to date and reviewed by the physician. So this can help possibly rule out certain diagnoses when they're trying to figure out what disease process is happening. So that's your job as the medical scribe, is just to listen, make sure it's up to date, and make sure it's being reviewed by the physician. Per usual, any questions, comments, or concerns, please feel free to reach out to me.